list, you think? Just in case her luck strikes again.
Yeah, she should be so lucky. All right. American Academy of Pediatrics says children and teens are experiencing a mental health crisis like never before because of COVID-19. Fox 11's Andres Esparza joining us now with the Children's Cabinet, who are working directly with parents to help identify mental health struggles their children might be facing. Hi, Andrea.
Hi, good morning, Taylor. I was doing research yesterday, and about 1 in 6 American students or even children between the ages of 12 to 17 suffer with depression and anxiety. And that's exactly what we're going to be tackling here with the Children's Cabinet. I'm here with Taylor Morgan, and you're the instructor of this program. And earlier we were talking about you have full classes pretty much every time you host it. But what are the common things that you're seeing amongst parents and what they're asking for help for?
Absolutely. I think one of the biggest things that we're seeing right now is an increase in anxiety levels amongst children and youth especially. CDC reports a big increase as well in anxiety disorders amongst children across the country, and that's only increased within the past 2 years, of course.
Yeah, and so how do you approach that situation where you know something's wrong with your child and they don't want to admit it? So you sit them down, you kind of determine and assess and then address?
Sure. So one of the things that we teach in the Youth Mental Health First Aid course is a 5-step action plan. The acronym for it is ALGE, which makes it easy to remember. So the first step is approach and assess for risk of suicide or self-harm. So we're teaching parents how to approach, how to begin that conversation with the youth that they might be concerned about. Second step is listen non-judgmentally. The G is to give reassurance, and then the 2 E's, encourage professional help and encourage self-help as well.
So let's say you're having a conversation with your child. You say, are you having thoughts of suicide? Is everything okay? And they say, no, I'm fine. I don't want to talk about it. But you as a parent, you know something's wrong. What are some tips you can give to parents to move forward?
Absolutely. Well, the listen part is such a key component of this step. And a lot of times youth who are experiencing a mental health challenge, that's all they need in a lot of cases, is just somebody to be there and listen. And by asking them that question, by teaching people how to approach and have that conversation, it gives youth an outlet to potentially have that conversation. And then from there, if needed, we can get them connected to that professional help, which can help them with the additional steps. So whether they're having issues with anxiety or anything from that to thoughts of suicide, it teaches adults how to begin that conversation, how to open the door, and to be able to effectively have that conversation with the youth.
Yeah, I couldn't agree more. And in the next half hour, we're going to be talking about why there seems to be a generational gap when it comes to tackling anxiety. Back in 1985, there was an 18% increase of people with anxiety, but now we're facing over 55% of children who are suffering with anxiety. I have that for you in the next half hour. Back to you.